Good morning again. Good morning. We're going to go ahead and get started as we continue to let folks in. So good morning. My name is Yvonne Sherrill. I am the CEO of the Ohio Urban Resources System. Here is my contact information. Please, if you have additional questions about ours, what we do, our network, and some of the things that we've accomplished in public policy, please do not hesitate to contact me at this information. So before we get started with the official program, let me offer you a few housekeeping items. One, we'd like for you to locate your program agenda. When you register, you should have received a follow-up email notification with all of the information for today, the Zoom information, and the downloadable program agenda version. So please take that out and follow along with us. Secondly, participants, please note that you would only have access to the chat room. So we ask that you, all your lines will be muted and that you will screen yourself so that we can concentrate on our presenters today. So we encourage you to please submit your questions, your comments in the chat room, and then we will save the question and answer portion for later in the program. So just go ahead and put it in the chat room. Sharon and I, we are like Wonder Woman twins. We will do a great job of making sure we capture all your questions so that the panelists can address it later. We absolutely love social media, and all of our panelists are great Twitter folks and Instagram folks and Facebook folks. So please, whatever, moves you, if you hear a really inspiring quote, if you hear some statistics that you just need to share, if you want to highlight how great our presenters are and the information that they're providing today, please feel free to post and tag us and use the hashtag hours 2K21, hashtag virtual learning, hashtag leading for impact, and hashtag urban CAA. So please feel free to tag us in your posts. At the end of this session, we encourage you to complete the evaluation. We can only provide the kind of training, the kind of content that you desire if we hear from you. So you have to tell us what works for you, what will help you be the best advocate, the best community action agency staff member. So please fill out the evaluation so we can further this discussion in other settings. And lastly, you will receive any shareable presentations or materials after the event. At this time, I'd just like to talk to you a little bit about the Ohio Urban Resource System. It is our mission to empower Ohio's urban community action agencies for maximum impact. We envision the Ohio Urban Resources System as a leading entity strengthening the social and economic security of families and their communities. Ours serves as a catalyst for capacity building and advocacy within the Ohio urban community action agencies in the state of Ohio. And our agencies represent about 56% of the state's total population and 62% of those households that are living at or below the federal poverty level. We seek to reduce the number of households living in poverty so that no family experiences food insecurity or housing challenges, and they are all able to earn a livable wage. In June 2021, Governor Mike DeWine signed the 2022-2023 budget bill into law. With support and tireless efforts of elected officials and state advocates, the poor in our state fared much better than we anticipated. Accessible childcare, support for local businesses, and healthcare are top of the line priorities for ours. So with the addressing the ongoing digital divide and limited internet access in urban community action agencies, we see this as an opportunity for us to join the state in efforts to safely move into COVID hybrid kind of models that will serve Ohioans. So now it's time for us to take back the conversation about what happens next in Ohio, providing timely and accurate information to all Ohioans, especially those who work in the anti-poverty organizations who are most likely to be connected to them. So I am ridiculously, seriously, on a Friday, like crazy proud to introduce to you our rockstar lineup of budget policy experts right here in Ohio. This is an amazing group of passionate and brilliant leaders who will address state issues ranging from healthcare, Medicaid, to affordable and quality childcare, criminal justice reform, and more. So it is at this time, I'd like to introduce to you each of our presenters for today. We have Mr. Nate and again, please follow their bios in your program agenda. We have Mr. Nate Kaufman of CDC Associate, Ohio CDC Association, Carly J. Booz, Esquire, Affordable Housing Alliance, Will Petrick, Policy Matters, Ohio, Dr. Zaria Davis, New Directions Coaching and Consulting, Lauren Anthus, Center for Community Solutions, Kevin L. Jones, Impact Community Action Agency. What I can absolutely tell you about each one of them, I have a pretty good personal relationship with them as well. I know them in their capacities, I know them in their spaces, and what I can say for sure that each one of them are just as genuine and authentic as individuals and as members of our society as they are advocating for the rest of the people. So at this time, I'd like to turn over the agenda to Nate Kaufman.
Good morning, everyone. And Yvonne, thank you so much for having me here at the summit. And it's a delight to join this panel. My name's Nate Kaufman. I'm with the Ohio CDC Association. We're a membership organization of community development corporations, locally based nonprofits that work to revitalize their community through a variety of tactics: affordable housing, financial empowerment, community engagement, local food access, and economic development, and which all of you are engaged in and doing wonderful things in your community. I also want to give a shout out to Bo Chilton, who is on our board and our policy committee chairperson, and also a leader with ours. A couple of announcements. I'm going to get into just a little bit of some observations relative to the state budget and also federal spending and some other regulatory items. But before that, we at the association, our membership, we have a reciprocal dues arrangement with OACA. So all ours members, all of the community action agencies are members, but I would profess that we are very weak in our database when it comes to community action staff contacts. And so I just put in the chat there my email. You all are members, and if you don't get our communications relative to grant announcements, engagements on policy and advocacy and so forth, please just email me your contact information. We'll make sure to get that into our database so we are engaged with you all. Also, oh, and you know what? No, there we go. And also want to give a commercial that we are having a hybrid annual conference with safety in mind first. In Youngstown, we're having a small in-person gathering and then virtual options. And that conference is coming up October 6th through the 8th. And so that is in your chat as well. If we'd love for you to join us, whether it be in person or virtually for our annual conference here in 3 weeks. So, you want to talk a little bit about the state budget relative to community economic development. And with it being Friday, I'm going to be a little bit of positive and have kind of a glass half full stance. Of course, there are a lot of things in the state budget and going on in state government and legislature that we can all bemoan, but I want to just kind of take us back in time a little bit. The first half of the year was the state budget, the state biennial budget. And, we were advocating for different programs, and I'll mention that at the end. But, broadly, if you were looking at the state budget, come June when we were, coming to the end, which had to be enacted by June 30th, it did not look good at all. And all these surprises came out of into the Senate budget version with hostile SNAP food stamp requirements, a measure from that would do horrible things to the affordable housing industry and decimate many existing affordable housing projects and also make future projects unworkable. And then also no real investments. And I know myself and other advocates and probably many on the panel here were like, oh my goodness, this is not looking good as we go down the home stretch into the state budget. But in the end, with a lot of advocacy from stakeholders and advocates across the state, many on this panel, what happened with the items I mentioned is that those SNAP requirements were removed, thankfully. The affordable housing real estate tax measure, which would have been, which I'm sure Carly will probably speak to, that was removed as well. And then, given the conservative nature of the legislature, there were, sizable investments placed in the budget. Not perfect, not everything that we would want, certainly, but given the makeup of the legislature and the history over the past 10, 20, 30 years, I think it's something that is positive. And I'll highlight just a couple of those things. So there's $350 million that were allocated for brownfields remediation that advocates such as Greater Ohio Policy Center were advocating for. There was also $150 million put in the budget for commercial and industrial demolition. And that was advocated for, I believe, primarily by the Ohio Land Bank Association. And then I know a future speaker, I'm sure will mention this, but $250 million investment in broadband. And then, we had those are all big spending measures. Let me see here. Excuse me while I navigate the Zoomer. And then we at the association, we also advocated for a new program that I put in your chat box that we called the Main Street Job Recovery Program. And this was our first go around where we were essentially wanting to replicate the U.S. Department of Health and Human Services Community Economic Development Program. We have a huge problem with acronyms and titles in the community development space. And what this program does is it couples job creation with locally driven revitalization efforts. And so we were able to get that into the budget, not the final figure we were hoping for, but we're still actively advocating to multiply that with American Rescue Plan Act state aid dollars. And it appears that we will be administering the program. So as members, be on the lookout in the coming months for an RFP for the Main Street Job Recovery Program. And then, so moving on, so the final observation I just make there is, of course, there are many negative things in the state budget, and many negative, as I look at the State House here, many awkward and negative things that happen over there. But putting it all in perspective, I think it was a lot better than folks would have thought, especially if you took a scan of the state budget in early June. Lastly, I just want to make a couple an observation and a couple mentions relative to federal policy. This is not comprehensive of all policies that impact you and your communities, which has been just remarkable, everything that's happened in the last year and a half. But I do want to highlight a couple of things, keep on the positive theme as well. We were very active along with our national partner, National Community Reinvestment Coalition, during the Trump administration, the comptroller of the currency, Joseph Otting, came into office in 2017, and he came for one express purpose, and that was to dismantle the Community Reinvestment Act, which was created in 1977 as a means to counter the decades of disinvestment and discrimination and redlining. It's not a perfect act, but it's done, some good in putting capital where it's needed into low-income communities and communities of color. And it was up for review. He came in, wanted to dismantle it. There was 2-3 year fight, and then finally in April of 2020, they asked for final comments. 90% of the comments were overwhelmingly against what the Office of the Comptroller of the Currency wanted to do to the Community Reinvestment Act. They disregarded it wholly, and Comptroller Otting, in just a matter of weeks after the public comment period ended, enacted his onerous and harmful reinvention of the Community Reinvestment Act, and then immediately resigned and moved to his country club that he owns in Las Vegas. I don't like this guy, if you can't tell. But so people were very worried, especially if the administration was to continue for a second term. Thankfully, just recently, the new administration and the new leadership at the OCC, they rescinded that CRA rule. And so the process is going to start anew. And as opposed to going it alone, as the OCC did, disregarding the positions of the FDIC and the Federal Reserve, there will be a more united and logical process with community input of those three regulators to create a CRA reform that works for everyone. So we will be involved in that with our national partners and our members, and be on the lookout for information on that as this new process begins to create a CRA that works for everyone. And then lastly, I would say, looking at, federal spending, I know it's been just, of course, unique to say the least, last year and a half for all of us. And if you go back in time and just a year ago, just 1 year, and think, do you think, and then think about everything that has happened federally since, and I don't think anyone would have imagined, one, the election outcomes, two, the level of public investments that have occurred. Not perfect, but certainly, something to build on. And I'm not, we've gone through, a solid, 4 decades of austerity, ruling the roost. I'm not saying austerity is dead, but who would imagine these levels of investments a year ago? And having on a national level, not on a state level, but on a national level, deficit and debt hawks have at least lost power and have been muted to some degree, which is incredibly positive. So you are all doing incredible work with the ERA and many other programs that you're administering, but it's just amazing to see all of this happen, and the poverty reduction that goes along with it, from child tax credits to CARES 1, CARES 2, ARPA, and so forth. And lastly, I would mention on that, relative to community economic development, let me see if I can do this, is right now we are, of course, in the heat of the infrastructure bill, which could be one of the most dramatic investments in human infrastructure in the last half century. Not saying it's perfect, but hopefully we will get most of this passed, and everyone, of course, follows the politics. But in terms of affordable housing, and I'm going to put a link to an article recently that, if this 300 billion plus in affordable housing investments makes it into the human infrastructure bill, it will be radical, and I say that in a very positive way, investment through the entire spectrum of affordable housing. One thing I do want to highlight, and I will pass it off here, is the Neighborhood Homes Investment Act, which we are very hopeful will be a part of that final bill in the affordable housing measures. And what the Neighborhood Homes Investment Act is, to put it simply, would be a single family low income housing tax credit. Our membership up and down the state has a great desire and sees a need to foster home ownership, and especially in light of us not even coming close to recovering from the Great Recession and all the disparities that took place there. And this would be a major investment, a permanent tax credit resource to provide home ownership opportunities and make those communities and neighborhoods more cohesive. So we're very much hoping that that makes it into the final infrastructure bill. So thank you for hearing me out. I hope I wasn't too Pollyannish. There, of course, is a lot of other things happening, but on this Friday morning, I think there are some positive observations, especially during these times, that we can, all take heed of. And so with that, I think I am at my time, and I am going to pass it off to the spectacular Carly Booz of the Central Ohio Affordable Housing Alliance. Carly, take it away.
Thanks, Nate. And I don't think you're too Pollyanna at all. I think this is a once in a lifetime shot, and we're gonna swing for the stadium, right? So I am Carly, and Yvonne, if you want to pull up my slides, we can just kind of start going through them. I am the executive director at the Affordable Housing Alliance of Central Ohio. I'm going to talk today a little bit about kind of what the affordable housing scene is here in Franklin County, and what COVID-19 has done to it. But I will say, although I'm kind of coming at this from a Columbus, Franklin County perspective, that these dynamics really are true in all of our major central cities, and quite frankly, most of the state as well. And you can advance to the next slide. The Alliance itself, we are a nonprofit organization. We're also a membership organization. And we have housing professionals from across the spectrum, the investors, the financiers, the developers, the property owners, as well as housing counselors and advocates and homeless shelter operators, because we like to have that nice, robust kind of conversation within our membership on what solutions look like. And our role in the world is primarily to advocate for those solutions, so to make sure that Franklin County has the resources we need to solve the housing puzzle. And we do that through a lot of research. We're very data oriented, through consultation and technical assistance to the people who want to do right, have the tools to do so, and through mentoring and leadership and facilitation to kind of help these ideas grow. So on the next slide, you can see, I believe, if I'm remembering my slide deck correctly, a little bit of a data landscape on what is happening. Thank you. At the Alliance, the kind of canary in the coal mine data figure that we track most closely is the number of households that are housing cost burden. In fact, that are extremely housing cost burden, pay more than half of their income towards housing. And the reason we look at that one is because that's when families start making life and death choices basically every month when their housing cost comes due. When they have to pay rent, they're deciding whether or not they can afford their insulin or they're going to pay their rent. When their mortgage comes up, they're choosing whether or not to make their kids a healthy meal or to go to work to pull extra shifts to cover their costs. And unfortunately, in Franklin County, 54,000 of our households are at that danger zone. And that's going to have a lot of ramifications that are going to kind of echo through the rest of the world as well. So one of the things that we know is this problem is getting worse, not better, that we are nowhere near building to what we need to be, not just for our current needs, but especially when you consider that Franklin County is growing like wild And we should be putting 14,000 houses up every year just to meet that growth. And we're not, we're doing 8,000 most years. We also know that because of that shortage, the most pressure is going to fall on the most vulnerable households. So for example, extremely low income households, those that are at the minimum wage level, those that are benefit dependent or fixed income, we only have 32 homes for every 100 families who need them. And we also know that this isn't just for those people who are in retirement or who are young, it's for working families as well. In Franklin County, you need to earn almost $19 an hour just to afford a modest 2-bedroom apartment, but almost none of our common jobs pay that. The only one out of the top 10 jobs that hits that rate is the registered nurse. And if you want to go to the next slide, I always kind of try and end my scary data section with like a positive note, which is that most people don't realize Franklin County is naturally an expert in this. We are home to national players in the affordable housing scene who've worked everywhere. They've worked in LA and Austin and Colorado where things are terrible, and they've learned lessons there, and they want to apply those learnings to Ohio and say that we're the first community, the first state to solve affordable housing. That's a capacity that I don't think anybody else has. I also want to be really clear that while that 54,000 housing cost burden number is informative, it's not the only metric that we can track. And one of the biggest reasons for that is it conceals a lot of hidden disparities along racial and ethnic lines, on gender lines, and a lot of different intersections. So if we look at the percentage of households by race that report being cost burden, within the county, we're seeing a 12-point differential. 55% of African-American headed households are cost burden compared to only 43% of their white counterparts. And if you flip to the next slide, you can see that that same phenomenon is true in a lot of different contexts. So if you look at homeowners, a home that in Franklin County or in Columbus sits in what had previously been green lined, it had not been a red lined area 100 years ago. The average equity that house has and the owners in it have is almost $430,000. The same house across town who had been in a redlined area only worth $100,000. That chart there is what intergenerational wealth and wealth stripping looks like in one graphic. If you skip ahead, we see that this same dynamic impacts eviction rates. And the chart that's coming up is going to talk about specifically evictions during COVID-19. In Franklin County, 24% of our residents identify as Black or African American. However, almost half of those who are coming into eviction court and saying, I need help, I need a lawyer, and going to legal aid for assistance are African American. So you're seeing almost a doubling of what we should compared to normal population trends. And then finally, on the last slide in this section, that exact same proportion split ends up in our homeless shelters as well. So again, although we only report 24% of our households being headed by an African-American family, we see 66% of homeless shelter entries reporting that they are African-American. If you go to the next slide, then I'll talk a little bit about kind of what COVID-19 has done. And this data is kind of the precursor to COVID, right? This is what the landscape looked like right before it hit. So if you take American Community Survey data from 2017 and you compare it to 2019, for data nerds, you'll see that I'm comparing the 5-year average versus the 1-year average, which is a choice because we want to get historic accuracy, but temporary timeliness. Just full disclosure there. What that says is that we've lost 20,000 units that had previously rented for $900 a month or less. That's insane. In 2 years, we've lost basically an affordable housing portfolio the size of the entire city of Reynoldsburg, or the size of the entire city of Pickerington. At the same time, we have gained housing on the other higher end parts of that spectrum. Next slide, please. With COVID-19, there were early projections that about 400,000 households would eventually lose their homes to eviction because of the pandemic. The state itself would lose about $800 million in revenue. That's larger than the gross domestic product of a lot of our counties all by themselves. And it would be about a 7-fold increase in the number of evictions year to year. That projection came in about a year ago. We've been tracking, again, US Census Bureau data to see, well, what is coming true? Was that a prediction? Was it scary? Was it wrong? Unfortunately, it's looking like it's pretty dead on. So in the Pulse survey, we're seeing that about 380,000 Ohioans every single month for this whole year have not been sure how they're going to make next month's rent payment. I mean, that's been pretty consistent. One of the newer trends we're seeing is a number of the households that had previously said, I can't pay rent, I can't cover this expense, felt like they had options. They felt that they saw a way out of eviction. They could borrow, beg, steal. More and more see this as the last choice now. Go to the next slide, please. At the bottom, you can see that was what our eviction rate is. This is the eviction data in different census tracts, or pardon me, different zip codes here in Central Ohio. I know not having the 270 circle is really disorienting for me. I apologize, I don't know how to do that yet. But if you're familiar with Franklin County, what you're seeing here is the upside down T, which means that our eviction rates are basically mimicking what our red line maps are. And you're seeing higher proportions in those counties that have higher concentrations of African-American and ethnic minorities. Next slide, please. I will say very, very quickly that that doesn't need to happen. We have tens of millions of dollars to stop the eviction crisis, but not enough people know about it. So if you know someone who is struggling in Franklin County, Impact Community Action is wonderful, and they are administering those funds. Next slide. In fact, they've already released about $40 million, so we are just going gangbusters. Again, as somewhat of an aside, this is a problem that is likely going to stick with us for decades because COVID-19 has completely blown up what pro formas look like to build affordable housing. So our costs are higher, but the amount of money we have to build housing is staying the same, which means we're just building fewer and fewer units. So that housing gap is growing larger directly as a result of COVID-19. Next slide, please. I am gonna, and you can click 1, 2, 3, because I've got a couple little pop-ups that happen with this slide too. I'm gonna do a couple shameless plugs. We just released a report called Work and Home that explores what the affordable housing shortage means for workforce development and for economic development. And in what ways is our lack of housing making our economic future as an entire region more precarious. And one of the findings that I thought was really startling was that 80% of employers that we surveyed said that they are seeing reduced productivity and reduced employee morale because of the lack of housing we have in Franklin County. And half of those respondents said that they themselves, as employers, are experiencing higher turnover costs and higher retraining and retention costs because of our housing shortage. Next slide. Again, shameless plug. We're going to dive into these issues even deeper on September 28th. And we've got this killer panel that's going to come talk to us. And it's experts from across housing, across workforce, across government leadership. It's going to be wonderful. And I'm going to drop it in the chat because you can't stop me. Next slide, please. So to talk about some of the solutions really quick, all of our cities, all of our state right now has an absolutely unprecedented access to major financial power. The American Recovery Act in Franklin County alone has dropped about $450 million in relatively unrestricted funds to help set things straight. And we know from looking at the Great Recession and the Great Recession and the S&L crisis that housing is one of the surefirest ways to come out of economic trouble. Because when you build a house, you pay a local guy to build it, you buy your supplies local, you pay your taxes local, and then ultimately you sell it to a local family who pays and stays in the community. It is a stimulus every way you slice it. Next slide. So one of the things that we've done at the Alliance is to ask, what would it look like if we took that same rule we've been telling our clients for decades, right? You should pay 30% of your expenses, of 30% of your income towards housing. That's what we say to everybody. What if as a government, we took our own advice and we spent 30% of these ARPA dollars on housing initiatives? It would be the fastest and the most equitable recovery anyone in this country has ever seen before. Next slide. We have a couple other projects that I think are incredibly exciting, and I'm featuring some of those that implicate our community action agency because impact is just hearts and kisses and rainbows wonderful. One of the things that's going to be coming out in the next few weeks is a one-stop shop eviction prevention website. Please to the next slide. What we are concerned about is that there's beginning to be resource confusion and information confusion because people who are struggling with eviction don't know where to go for help. And there's a lot of hype and a lot of buzz, and not all of it is accurate. This website is going to help cut through that and make sure that people can get to the rent assistance provider that is best suited to their needs, whether that's cultural competency and linguistic capabilities. It's a population that they're most committed to serving. They're in a geographic area that's convenient to get to. We want that information incredibly easy to find. Next slide. I'm also been working with Impact Community Action to provide technical assistance to our local government policymakers so that they understand what the Treasury rules are that apply to this relief money, and that we are maximizing the opportunity before us to get it out fast. So just yesterday, the City of Columbus released new policy guidance that is going to segue almost all of those ERA provisions to a self-attestation and data proxy eligibility slice. I believe we are the first city in the state to do that, and it's going to be wonderful. Nope, you're right on to the next slide. Thank you, Yvonne. And I'm going to try and blow through this quickly, mostly because you're getting a sneak peek at a program that isn't officially launched yet. I'm going to be putting the press release out for this here in a couple days, but you guys are at the center of this whole conversation, so I wanted to share it now. Next slide. Resiliency Bridge began when we started exploring a problem that families were reporting to us, which was that they are working, they're waking up, they're putting in 40 hours or 50 hours or 60 hours every week into a job, but they're still stuck at a wage that doesn't pay their housing costs. And we said, why? And they said, well, to go up the income ladder, I need to get education. To get education, I need to quit my job. To quit my job, I lose my house, I lose my house, I lose my kids. Where do you want me to cut? And it certainly wasn't feasible for them. So next slide, please. We got together a team of experts and we just asked them, what do you think about this? And we brought in lived experience experts, people who are part of the problem as well, to join our table and start solving it. Next slide. And what Resiliency Bridge is going to do, it's going to blend free, no cost career education with housing stability and housing affordability while they are getting that education, as well as every other support system we can imagine. No cost childcare, no cost food access, no cost internet and device access, mental health and personal counseling and coaching. And then at the end of this 9 to 12 month program, we're going to help them secure a job. Next slide. And our bet is that by approaching this with that holistic point of view, we're going to help people grow their incomes from the day they enter the program until the day they exit it by 75%. That over the course of the next 3 years, they will reduce their entire household public benefit usage by 75%. Next slide. And I am unfortunately out of time, so I'm not going to talk about any of the other slides. I would love to if there was time, but I do need to give recognition to the JP Morgan Chase Foundation, who came to us before this idea was even an idea. And they gave us the space to think about it without kind of funneling into grant parameters. They basically said to us, if you've got the idea and it's the right one and it works, we will be there at the end of the day with the funding to make it happen. And that was an unprecedented opportunity that allowed us to bring in the Franklin County Board of Commissioners and the Columbus Metropolitan Housing Authority to fund the entire year of our pilot program that will, like I said, start here in a couple days. So I will stop talking, but thank you so much for the chance. And I'm always happy to answer questions. And I'm sorry, I'm trash at this. I am now going to turn over controls to Will Petrick at Policy Matters Ohio, who is wonderful and will be talking about affordable housing, or pardon me, affordable childcare and how we support our families.
Thank you so much, Carly, and thanks for all your awesome work. Also want to just say thank you to the Ohio Urban Resources System for organizing this program, and thanks to everyone who took time out of your Friday to join us today. Again, my name is Will Petrick. I'm the budget researcher with Policy Matters Ohio. We believe that all Ohioans, whether white, black, or brown, deserve to thrive. And our mission is to create a more vibrant, equitable, sustainable, and inclusive Ohio. And I initially got involved in this work because I believe that every child deserves to be safe, healthy, and nurtured. I also believe that every parent, no matter how much money they make, deserve to be able to go to work with the assurance that their kids are safe and cared for in a great environment. So I'm here today to talk more about policy solutions that can make childcare more affordable for working parents and ensure high quality childcare for all our kids. Before getting into policy, I do want to start with just why high quality childcare is essential, and also outline just the current challenges facing kids, families, workers, and childcare providers. So first, with this question of, why is childcare essential? One, high quality childcare is an investment in our kids and their future. We know that babies' brains develop fastest from birth to age 3. And during those first 5 years of life, a child's experiences and relationships, both positive and negative, really build the foundation of their brain architecture, and that impacts their ability to learn, their behavior, their overall health. So the research shows that kids who have access to high quality early childcare and preschool do better in school. They have better employment options compared to peers who don't have that access. They also have improved health outcomes and reduced involvement in the criminal justice system. Childcare is also essential because it helps parents to participate in the workforce, particularly moms. There's a lot of recent data showing that women left the workforce at really alarming rates since the pandemic emerged last year. And a lot of this was due to a lack of affordable childcare options. Again, the research shows that policies that reduce the cost of childcare, that increase access to childcare, have positive effects on maternal workforce participation and their work hours. Finally, we call childcare the workforce behind the workforce because it's critical infrastructure for our economy. Local businesses have really woken up. They've reported problems with finding workers, and ultimately they're beginning to recognize just how important affordable childcare options are to attract and retain workers. Can folks hear me okay? And next slide. Cool. So, even before COVID, for decades, really, state and national lawmakers haven't devoted the resources required to build a bright future for our kids. So again, even before COVID, thousands of families couldn't afford high quality childcare, and too many kids started school well behind their peers. This slide shows that our childcare system is built on a low-wage workforce. It's a workforce of primarily women and disproportionately Black and brown women. So the women make up 95% of the childcare workforce, and they make an average of just $10.90 an hour. These low wages really reflect how we, as a state and a nation, undervalue this essential work. Next slide. And even though workers are paid such low wages, childcare can still be crushingly expensive for families. So this shows that the average cost of tuition for high quality childcare for an infant in a center-based childcare setting is just over $10,000 annually. That's comparable to the average cost of a public 4-year university tuition. Next slide. And the next slide shows the same thing, but from the perspective of a working parent. So say you're thinking about a single mom with a 4-year-old and an infant, and she's working full time at $15 an hour. She makes too much to qualify for a public subsidy. So she makes too much to qualify for support to help afford childcare. But at the same time, she spends over half her income just to provide childcare for her kids. And she's left with little to cover the other basics, to cover food, housing, transportation, and healthcare. So it's really a tough spot. Next slide. And this slide shows that this is a choice that we make as a state. So childcare access and childcare affordability is a policy choice that state lawmakers determine. So you may not be able to read all the this slide, but Ohio is near the bottom in terms of, again, support for parents who need childcare. Before the recent state budget passed, a family of 3 making $28,000 annually, again, made too much to qualify for publicly subsidized childcare. Lawmakers did move the needle a little bit. So there's kind of the Ohio before and Ohio after. So they increased initial eligibility from 130% of the federal poverty level up to 142% of the federal poverty level. So, you know, that same parent making $28,000 before who wasn't eligible is now eligible. But again, say you're a family of 3 making $15 an hour, you still make too much to qualify for support in Ohio. That same parent, if they're living in 41 other states or in DC, they are getting some support to help pay for childcare. Next slide. I also want to just note, you know, this piece around initial eligibility and affordability and access. This is why Policy Matters called on lawmakers during the budget to make childcare more affordable for more working families. We called on them to expand initial eligibility up to 200% of the federal poverty level, and we'll continue to be advocating for that. So, you know, basically that's kind of a quick overview of the reality for parents and childcare workers. I also think it's really important to consider the perspective of childcare providers. So childcare centers, home-based providers, and day camps for school-age kids. So again, before the pandemic, these providers operated on razor-thin margins. The childcare industry really was teetering before, and the pandemic has had a disastrous effect. Like other businesses, providers had to close during the shutdown. Many had to reduce capacity. Some childcare providers have reopened, and they're still struggling to stay in business because they're serving fewer kids. They're experiencing challenges with recruitment and retention of workers. And there's also additional costs related to the health and safety regulations related to the pandemic. So this slide shows that there was a national survey done recently, and 76% of childcare centers reported a staffing shortage. And in Dayton, based on an August survey, 55% of childcare providers there reported having significantly lower enrollment of kids compared to before the pandemic, and 20% of providers responded that, you know, they're at risk of closing due to continued challenges. So, you know, there are major challenges facing childcare providers. And next slide. And ultimately, this having less options and less childcare capacity, again, hurts kids, it hurts families, it hurts our economy. One of the key metrics that we look at for kids is, it's called kindergarten readiness. So it's basically a state metric that looks at how many kids are ready to enter kindergarten, ready to engage, to learn and grow. In Ohio, only 26% of Black children and 41% of all children start kindergarten ready to learn. And this is really critical in high quality early education advocacy space, because we know that kids who start behind often stay behind. So through elementary school, high school, and even on into the workforce as adults. So again, we need to provide more access to high quality childcare, not less. This has also, again, had a huge impact on parents, particularly moms. There was a National Women's Law Center report that highlighted that more than 2 million women have left the workforce since the pandemic began. So the pandemic really showed how the lack of access to affordable childcare can knock parents out of the workforce and really send shockwaves through the entire economy. So again, that's why we talk about childcare as the workforce behind the workforce. Next slide. So that's, again, the context. And then we have this whole state budget process. And so this is a slide that highlights that there were some new investments, but it was all federal dollars. So there's no additional state resources for childcare access and affordability. It's also important to note that while there's additional dollars that were appropriated, these are federal stimulus dollars. So these are one-time dollars. This is not necessarily a sustainable increase in prioritization of childcare. Next slide. So what does it all mean? Those numbers on the last slide. I mentioned the state lawmakers increased initial eligibility from 130% of the federal poverty level up to 142% of the federal poverty level. We estimate that roughly 6,000 kids across Ohio will gain access to publicly funded childcare. They'll be able to now afford childcare. Similarly, there was also an increase in initial eligibility for families with kids who have special needs. So this will mean an estimated 100 children with special needs will be served in the current fiscal year, and 220 to 250 children in state fiscal year 2023. Next slide. There's also, basically kind of guardrails on how Ohio can and should use federal stimulus dollars for childcare. So there's money through the American Rescue Plan Act and the Consolidated Appropriations Act. That was a stimulus package that passed in December of last year. And basically the budget says, these funds have to be used to stabilize childcare providers, to retain and develop and support the workforce and recruit more people into the childcare workforce. And again, also to help make childcare more accessible and affordable. There's also an earmark of $50 million for that money to be used to provide co-payment assistance, specifically for families accessing publicly funded childcare. So that's working families with lower wages. The budget also makes some changes to step up to quality. So there was at one point during the budget, an elimination of step up to quality. The final budget did restore the 2020 mandate for publicly funded childcare providers to be at least a 1-star rating. So this is childcare providers who offer subsidized childcare to families. So families who are getting state money to help be able to afford childcare. So those providers do still have to participate and step up to quality and be at least a 1-star rated provider. But the final budget did remove the requirement for providers to be at least 3-star rated by 2025. So the initial intention of step up to quality was that by 2025, all childcare providers who were serving families and serving families specifically in publicly funded childcare would be at a high quality rating. So they would improve their quality over time. The budget eliminates the mandate for childcare providers to do that. It also creates a study committee to look at publicly funded childcare and step up to quality. So they'll be having hearings over the next year, and that report is due December 1 of next year. So that's one thing that we ask everyone to kind of keep an eye on, to follow, and to really highlight the value of step up to quality, that we really need high quality early education for our kids, but also the value of publicly funded childcare. Next slide, please. And I'm going to go quick. I know my time's running short. So again, I mentioned the American Rescue Plan. This was signed into law March 7th of this year. And Ohio is getting roughly $1.3 billion. Broadly, again, that's for stabilizing the childcare industry and childcare providers. It's also, there's funds, again, to expand access to childcare. Next slide, please. One thing to note is that, while these resources have been allocated, that money actually has not yet been allocated in the state of Ohio. So this, again, is an area where your voice matters. and where we need to get that money out
Come
of
on,
it.
love.
Right? There are providers who are literally on the brink of going out of business. And so there's an urgency to get that money out into our communities, to families and to childcare providers. This is another piece that I think was mentioned earlier. It's called the expanded child tax credit. And this is not necessarily specific to childcare, but broadly thinking about families and the family budget. This is something that is going to be really meaningful for reducing child poverty and just providing all families with security, with stability. It's only in the American Rescue Plan. It's only included for 1 year. So again, this is another federal advocacy opportunity to say we need to make this permanent. But families in July started receiving monthly checks or monthly deposits into their bank accounts. So parents starting in July got $300 a month per child under age 6 and $250 a month for kids ages 6 to 17. Again, ultimately, this is going to give kids an opportunity for a brighter future. It's going to take stress off of struggling families. And it's just, ultimately putting more money in people's pockets. So this will help families pay for the basics. It can help pay for food, for housing, for healthcare, and childcare. So next slide. So I wanted to close with just a couple things that folks can do at the state and the federal level, because there is a lot of opportunity, particularly at the federal level right now. I think the state budget just passed, so we have another state budget 2 years from now that will definitely want to influence the priorities of our state. But ultimately wanted to leave you with a couple ways to take action. So ultimately we know that the childcare market won't solve the problem. And I started with, it takes a village to raise a child. So we see that as all of us, as advocates, as people in the community, as organizations doing this work day in, day out. But it's also local, state, and federal government making changes to improve people's lives in concrete ways. So at the state level, again, we're going to continue to push for access and affordability and, highlight that childcare helps parents get back to work. And really, we want to see childcare affordable for all parents who need it. So we need to expand initial eligibility in the next state budget from 142% up to 200% of the federal poverty level. Again, there's also those federal resources that we haven't yet spent in this state of Ohio. So we need to make sure those dollars get spent strategically to sustain the childcare system, to improve quality, and also ensure that equity is embedded in that process, that historically families who have been left out, providers who have been left out, that we're prioritizing those families and those providers that most need security and stability and support now in this crisis. Next slide. Again, at the federal level, there's discussion ongoing about a $3.5 trillion budget framework. And, included in that is our provisions to establish universal preschool for 3 and 4-year-olds, and also a new child care benefit for working families. And so under Biden's proposal, basically low and middle income households would pay no more than 7% of their income on childcare. And this would be really meaningful. So parents earning up to 150% of the median income would qualify. So this would be a game changer for a lot of kids and families. President Biden also wants to invest more in the workforce to bring their wages up to $15 an hour. So again, just wanted to close with, Senator Portman, Senator Brown, your Congress people, they need to hear from us now. This is kind of a moment like we haven't had before. This infrastructure package could be historic. And we need to make sure it includes this type of human infrastructure to really make sure all Ohioans can live with dignity, have that security and stability. So with that, next slide. If you are interested in learning more, my contact info is there. I think you'll have the slides. So, feel free to email or reach out to me. Again, thank you all for joining us. And I think I'll turn it over to Dr. Zaria Davis at New Directions Coaching and Consulting. Thanks.
Thank you so much, Will. Appreciate it. It is good to be here with everyone today. And I'm going to be talking a little bit about the topic of pretrial justice in Ohio. And I just want to share that I am a consultant with a national organization called Pretrial Justice Institute. I've been with the organization for over 2 years. Was serving as a senior associate with them and then transitioned into a consultant role specifically to do work in Ohio. In addition to the pretrial justice space, I do want to also add that I do a lot of work in the reentry space. So I am going to drop some different links in the chat as far as resources, because I will not be able to cover everything in this time period. So I just want to start with just kind of looking at what are some of the goals of pretrial justice. And this is a big topic right now in our state, because we have a House and a Senate bill that are currently underway to reform the current bail system. So I just feel like this is really appropriate, especially as it relates to the people you may be serving in your communities and their families. So the goals of pretrial justice are typically to achieve equity, to reduce harm, the harms of mass incarceration, and then to eliminate financial conditions. So right now we have a system, unfortunately, that is set up that really looks at people's ability to pay. And so for a lot of the people that we serve, they are sitting in jail, not because of the type of crimes they were charged with, but because of the lack of being able to pay to get out. You can go to the next slide. And so as a result of that, we are not really honoring how our system was originally set up. And that was to maximize liberties, to maximize appearance in court and in public safety. So what we find oftentimes is you'll hear about people who may have warrants that are out because they didn't show up to court. And we'll talk a little bit more about this, but appearance in court is a huge barrier for people when you lack resources and supports within the community. So the work that you all are doing is critical in this space because we want to make sure that we are filling in those gaps of services and providing the supports that people need. You can go to the next slide. So I'm going to cover 5 hard truths about our current system, and then I'm going to share what's happening in Ohio and also talk a little bit about some of the COVID information, but I'll also, like I said, drop in those links just so you'll be able to kind of do some further research. So one of the hard truths about our current system is we've supported a presumption of guilt for people, especially people of color and working poor. So we don't have a system that oftentimes looks at people across the board and says, okay, is this person innocent until proven guilty? That is what we were taught in school. But unfortunately, it's typically the other way around, where people are assumed to be guilty and then they have to figure out how do they prove they're innocent. And so you can go to the next slide. When we look at just the numbers as it relates to data, we have a really high number of arrests. And specifically when we are looking at Black people who are arrested compared to their white counterparts. So you'll see on this slide here that the rate for drug possession is significantly higher, as well as simple assault, theft. And oftentimes it connects to like who's being policed, like what communities are being policed, how is that showing up? So the arrests for Blacks are typically twice as high as their white counterparts in those areas. And it's really unfortunate because we see this across the board. So not just with this particular group, but for this slide, of course, but we also see it with the Latinx community, as well as the Indigenous community as well, where we see high numbers of rates of arrest. You can go to the next slide. So this is an older slide, but still very significant. And I will just say that we tap into other resources. So this is from the Prison Policy Institute from 2019. And just looking at the total US population, where you have at that time 68% white, 12% Black, 13% Hispanic, but then you have this disproportionate rate of people, and this is specifically in the pretrial system, that you have a disproportionate rate as it relates to those who are within that pretrial system. So I just wanted to point that out to you all. And I would say McIntyre and Brendanall, they did an analysis from 1990 to 2006, and their data concluded that Black defendants are 25% more likely to be held in pretrial than white defendants. And then in their findings, they did look at age, gender, the number of legally relevant factors, so serious charges, prior arrests, things like that. And then Dobby and Yang in 2019 found that over half, 58% of the 39 sampled counties had a higher rate of pretrial detention for Black defendants than white defendants. And then 5 counties had unexplained racial gaps of over 20%. And this is national, these are like national numbers. So I just want you to understand that, but also understand that that does also trickle down into like what we see within our own state. You can go to the next slide. Oftentimes people are pressured, really to take guilty pleas. And so we find that a large number of people never actually face their day in court, as we talk about, right? A jury of their peers, or even the judge for that matter. No one really goes to trial. So about 85% of felonies and 90% of misdemeanors on a state level are done through plea deals. So that means that they never actually go to court. They basically agree to, take oftentimes a lesser charge than what they're originally charging them with. And I will say that this is a game, a really nasty game that is oftentimes played. And this isn't across the board, but there are a lot of innocent people that end up taking plea deals under duress. And we find that there are a large number of people of color and people who are in poverty who fall under this category. So I just always like to lift this up because, when we think about our court systems, we oftentimes think that, people are actually going to trial, but that's not the case. And even on a federal level, it's over 90% of people that typically do plea deals. So if they don't feel like they have the ability to win their case based off of information provided or misinformation provided, oftentimes people will do this, and a conviction will seal your fate. So for you all who are obviously working directly in the community, you know that people with felony convictions deal with so many barriers. And in Ohio, we have over 1,000 different barriers that people with felony convictions face. And so some of those things are dealing with like housing, employment, access to insurance, even getting credit oftentimes, because when they run credit now, a lot of times it's connected with your background. So all of these things factor in to a person's ability to live their life. So the pretrial phase really has an impact across the board, even after the conviction, after a person has done their time, or even if they haven't done their time, even after they've been released. So you can go to the next slide. When we look at inequities, again, there are a higher number when we look at white women, Black women, Latino women. There's still a significant number here. When we look at Black women, it's almost double that of white women. And when we look at, again, Black men, white men, and Latino men, the numbers are just extremely high. So 1 in 3 Black men, 1 in 6 Latino men, and then 1 in 17 white males. So just want to kind of lift that up when you're thinking about your clients, when you're hearing these stories and having these conversations. You can go to the next slide. The next hard truth that we're going to talk about is that we allow millions of people to serve time in jail each year without being convicted. So this is through arrest, money, bond, and culture. So in 2016, there were 10.6 million arrests, and this is from the Vera Institute. And when you think about the number of arrests and you think about the numbers we just talked about as far as the people that are sitting in jail, what we find is that a lot of people are in jail, not because of, again, the type of crime. Typically about 3% of the people that are in jail are there for what you deem like violent crimes. The other ones may be in there for like probation violations or, you know, misdemeanors or low-level felonies. You can go to the next slide. So this is kind of just a quick little map of a bar graph of just numbers of kind of looking at what that looks like as far as men and women. So this is just something I wanted to show, and I'm trying to be mindful of time, so you can go to the next slide. So 11 million arrests each year, 80% for low-level offenses, 15 for mid, and about 5% for violent offenses. And again, this information can be found, like I said, on the Vera website, just to kind of get more information. Next slide. Unconvicted people account for, and this is in 2000, the jail growth look outreach from 2000. So 95%. So they account for 95% of the jail growth since 2000, and most of them are unable to pay their bond. So again, we are looking at a money situation, right? And we know that mass incarceration is has an economic impact. People benefit from mass incarceration because you have a lot of people that invest in the various you know, things like commissary and uniforms and all these different things that we don't always think about, the telephones and anything else, tablets, for those that use tablets, all of that costs money, and it's typically at the cost of the family of the person that's inside. And so when you already think about people who already are lacking, and then they're trying to support their family member inside of either a jail or prison, we are just further and doing harm, you know, to our communities with this. You can go to the next slide. So race and bail amount. So the other thing that we want to look at is the fact that even when we talk about people posting bond, the amounts are typically 35% higher for Black men in our system and 19% higher for Hispanic men. So there are significant differences in how, like, two people can be charged with the exact same thing, have very similar backgrounds, and yet we see something very different when it comes to the bond amount that's being set for them. So all of these things are things that we have to consider. We can go to the next one. So the third hard truth is we believe that anyone arrested is risky, right? And we ignore their victimization and often pay lip service to the victim. So oftentimes, people who have entered into our system have been victimized. So these are people who may lack resources, supports, and sometimes, you know, they've done things really in an effort to survive, but instead of actually providing the supports and resources that people need, we just further criminalize the behaviors that they're, you know, that have brought them into the system. And so you can go to the next slide. And so what we always like to let people know is that poor people are not fleeing from justice. They're not, you know, when you hear about people getting these warrants because they didn't show up, oftentimes they're barriers, right? They don't have childcare, they don't have transportation, and nearly no one commits a violent crime against another person while they're waiting for their day in court. There are definitely going to be those situations where something may happen, but this is not like a very likely thing that's going to happen. So our policies default, you know, to basically based on the opposite of these things. So we just have to really keep in mind like what we're talking about when we think about pretrial and, you know, our justice space. You can go to the next slide. So in addition to this, we also need to consider like the childhood aspect of this as well. So childhood and young adult trauma amongst those who are arrested. There are very high numbers as it relates to child abuse and neglect, witnessing or being a recipient of violence, as well as just knowing that there's a high report for women who are in this space. So I am going to, I know I'm going to be transitioning, so I'm going to stop the slides here, but I want to just also just say, as I'm wrapping up, that there is currently, again, the House bill and Senate bill And that is going to, there's ways that you can get involved. I will drop all of that in the chat for everyone. I'll also drop some of these resources in the chat as well, for people who are interested. So I just want to thank everyone for their time. Please feel free to reach out to me. I'll make sure I put my information in chat if you're interested in more information. And I'll now like to turn it over to Lauren with the Center for Community Solutions.
Thank you, Zaria. Really appreciate all the information so far, and thank you to everybody with the Ohio Urban Resources System. I think, you know, what we've heard today underscores not only the opportunities that we have, but I think also the challenges that lay before us. And I'm here today to talk a little bit about healthcare and Medicaid, and I want to focus in on a few specific areas. You know, while we could touch on a number of policy issues within the Medicaid program in Ohio or nationally, I really want to sort of level set some of the national things we have been experiencing and what the implications of the public health emergency's role has been in the Medicaid program, as well as some of the things that you may be interested in as a part of your work every day, because while Medicaid is not necessarily something you all engage in as providers, I think there's going to be an increasing role for community action agencies, affordable housing providers, people who work on issues of justice involvement. There's going to be an increasing role in the Medicaid program. And so we'll talk about that a little bit. Next slide, please. Okay, so I want to highlight the public health emergency and its influence on the Medicaid program. So first of all, for those of you who have not heard this before, Medicaid is a first responder in public health. So when we think about our public health crises or our public health challenges in the state of Ohio, whether we're talking about infant mortality or the opioid use disorder crisis or COVID-19, Medicaid plays a role. It's a safety net, and it ensures that people get access to services and supports where they need. And what we had seen for the years leading up to the pandemic, for the few years leading up to the pandemic, was a decrease in enrollment over time. This was in part because we saw slow economic expansion. Also, there is some detail in regards to eligibility changes that were happening on the state and federal level, but less people were enrolled in the program. Now we're seeing a pretty significant growth in enrollment in the Ohio Medicaid program, where over 3 million people have been enrolled, primarily parents and kids. And this is driven in part by the public health emergency. One of the things that the public health emergency did was that it stalled redeterminations. So if you enrolled in the program, you don't have to go through the normal process of determinations. So your coverage is maintained, which makes sense. Number one, you don't want people to lose coverage at a time where they may get sick. And number two, you don't want to unnecessarily expose county caseworkers, you know, because a lot of times in our eligibility system here in the state, it's a very analog process. It's a county-driven process. So it's a way to promote public health and also promote people sustain coverage. However, in the state budget, there is a mandate that redeterminations for the Medicaid program take place within 90 days. I will go ahead and say that that's going to be nearly impossible to do and also incredibly expensive. But there are things the state can do to streamline eligibility, to make the process of what we call ex parte renewals, or in other words, like passive renewals, more possible. And the federal government, the Biden administration in particular, has put out guidance to help states understand what they can do and to help manage that. That's also important because, you know, I think that the issues surrounding eligibility with COVID-19 may be in flux. Right now, we're set to end the public health emergency, or most folks expect the public health emergency to end by the end of the calendar year. We're not sure if that's going to be the case. So if the public health emergency gets extended, we may see this eligibility continue Though at some point when it ends, there will be a strong push to try to get people to be redetermined. And so many of the folks that you work with, many of the folks who rely on this coverage just generally will have to do something to validate that eligibility. So it's important to pay attention to. Also, as a part of the public health emergency, were regulatory flexibilities through telemedicine and home and community-based services. So we saw a big, broad expansion to try to get people away from institutions. I imagine that for both of these, there is going to be a significant amount of change. Telemedicine, we saw the utilization of telemedicine go up 800% from 2019 to 2020. And this is because people didn't go to facilities. You know, we still have capacity issues in our hospitals. I think I saw in Franklin County, there are only 21 ICU beds available in Franklin County. So telemedicine is going to continue to be a tool. However, the way that it was deployed was very open-ended. The reimbursement rates also contemplated facility fees, but you know, the idea of paying facility fees when no one's going to a facility is something that the federal government and the state government, I don't think, would like to continue. And then there's also significant issues related to this for cities and city budgets generally. And here's what I mean. While many hospitals and providers don't pay taxes, income taxes associated with the provision of care from physicians and other medical professionals is often a huge source of revenue for our urban centers. If you deploy telemedicine and you have scope of practice able to translate across state lines, how do the taxes get impacted? I think this is an outstanding question that many of us will have to grapple with in the future, if only because if you can be a practicing doctor and most of your practice can happen in another community where maybe you aren't taxed at all, it could have a significant revenue impact for cities. Also, there's been additional funding and coverage expansions. One thing I really want to highlight here was the state expanded postpartum coverage for women in Medicaid. This was a part of the relief legislation, and where the state of Ohio used to only guarantee coverage for women who had delivered 60 days after delivery, it's now a full year. That has been shown to significantly improve maternal and infant health outcomes. A lot of folks on this table, around this table, this virtual table, advocated for that, and you know, the relief legislation provided a pathway to get that done more easily for the states. So we're really happy to see that. There's also other resources available to expand the role and utility of home and community-based services. So, you know, services in the home as opposed to institutions like nursing facilities. Also, mobile crisis. You know, as Dr. Davis had mentioned, some of the pre-justice involvement work that she had been promoting. We here have been working on a diversion center in Cleveland, and there have been some challenges, but mobile crisis is a part of that solution. How do we deploy the right sorts of professionals to avoid law enforcement involvement so that we don't rely on our justice system to be our de facto behavioral health system? A lot of money too. You know, one thing that we saw is the enhanced rates associated with Medicaid coming from the federal government. If you looked at essentially all the frozen budget line items or the avoided cuts, they almost match dollar for dollar that which was available to states through the enhanced federal medical assistance percentage in Medicaid. So Medicaid is bolstering state budgets, and there's long-term research, and I can point you to anything on our site about this issue that shows that recoveries happen more quickly, economic recoveries happen more quickly from recessionary periods with enhanced FMAP, and that budgets are made more whole. So it's been an incredibly important tool for us. And I would argue that a lot of the budget successes that we've seen are in large part due to this extra $100+ million a month that FMAP represents. Future states, some things to think about. The Medicaid gap policy in the context of the infrastructure bill. I'm not sure really what impact that's going to have in Ohio. It's much more designed for states that have not expanded Medicaid, but it's something to keep an eye on. Also, the presence of COVID-19. COVID-19 is not over, folks. You know, the virus and the spread is still very much in the community, and Medicaid recipients, for the most part, are under-vaccinated relative to the rest of the population. We did some research in this area and found that, at least in the city of Cleveland with zip codes with high unvaccinated rates, that there was a very strong correlation with hourly wage workers. In essence, folks who have jobs where they might be picking up hourly work, they may not want to take a day off to recover from their second shot, or might not be able to, because that $70 from that day of work could be an entire month's gas. So whether or not COVID is still around is going to affect a lot of these policies and the contemplation of these policies. And then, of course, the election. Jim Renacci is a very different person than Mike DeWine. Nan Whaley is a very different person than Jim Renacci or Mike DeWine. And depending on the dynamics of the General Assembly, what happens with reapportionment, so on and so forth, the political dynamics could change. And Medicaid, being such a pronounced part of the state budget, is often a political tool for these conversations. Next slide, please. One thing I want to highlight here that I think is relevant to all of you, and I talk about this often with my medical students, is the role that some of the policies that you all are grappling with now has in health outcomes. If we think about Medicaid as an insurance program, and we know that risk in insurance terms is the likelihood an insured event takes place, i.e. that you're going to pay out claims, then you have to understand this history. You have to understand the ways in which complex issues around communities, community development, urbanism, food access, so on and so forth, actually impact how you contemplate risk in Medicaid. The reason being, the CDC has said that 80% of outcomes are driven by things outside of the walls of a hospital. So our policy constructs and our thinking around what is actually going to bend our cost curve in Medicaid have to go beyond what we do in, say, a hospital, and have to go into how do we support communities and how do we ensure that communities have basic needs met for their residents. This report from the Annals of Surgery came out late last month, and they found that the redlining maps associated with the Homeowners Loan Corporation corresponded almost exactly to 30-day post-operative mortality, complications, and readmissions. And the implications of that are pretty significant. If we know that where you live is predictive of an outcome, then I would say that Carly, Nate, their work, whether or not there's a housing trust, whether or not we recontemplate something like lead safety in Cleveland, is going to have more of an influence than a Medicaid program specifically could. That being said, there is opportunity. Next slide. The opportunity to connect people to supports right now is often being translated through conservative states as, well, we need to get people connected to jobs. And this is where work requirements come out. Here's the issue with all of that. Part of the challenges that we have with work requirements is that we know that it's mainly just depressive in terms of enrollment. This is why the federal government had said we're not in agreement with the Trump administration's approach. We believe that work requirements in Medicaid are contrary to federal law, which I tend to agree with. And I think that there is iterative research to show that just providing access to coverage is more stimulative economically, provides more economic mobility for individuals than work requirements on their own. This, however, means that there's a political challenge, because I don't think the General Assembly, which has mandated work requirement waivers twice, is going to be really happy with that answer, especially as we enter into primary season. So for the 800,000 Ohioans who are in Medicaid expansion, who have seen the economic benefits of that expansion, including a reduction in medical debt, greater economic mobility. I think Carly was the one who mentioned people need access to education. We know that Medicaid expansion is correlated almost perfectly with taking economic risks, meaning you are more likely to ask for that promotion, go for additional training, so on and so forth, because some of your other needs are more readily addressed. Because if you're not spending your cash on, say, medical services or trying to purchase medications, or you're avoiding that surgery for your need, then you're more likely to take economic risks and actually move up the income ladder. Next slide, please. So the one thing I want to highlight here is the opportunity then that agreed upon policy, or at least where policy and all of your interests may align. Let me just state this. Ohio's Medicaid program as is most of public insurance, is really privatized. We rely on private contractors, insurance companies to effectuate the majority of public benefits in Medicare and Medicaid. And the reasons are complex and dynamic, and we could have that conversation. But long story short is that the policy thinking is it's easier to manage a contract and come up with a contract with a provider, an insurance company that can do the data analysis, that can work with providers to do innovative things. And there is also federal flexibilities for them to pay for things that are not strictly medical. There's some nuance here about in lieu of payments or value added payments. Basically, can managed care be platformed in a way to address some of these social determinants? The new procurement that is slated currently to go live in July of 22, I would argue represents the biggest opportunity for non-medical providers to be considered major players and coordinators of services as a countermeasure to the risk exposure of the state when it thinks about Medicaid. So we have new plans in our state, right? We have new plans that are trying to fight over who has what membership, and there's all sorts of new requirements on them to address social determinants, to partner with community-based organizations, to defer to community-based organizations. In fact, there are provisions in the new agreement that obligate a certain amount of profits from these companies go into communities on community terms. Here's my recommendation to all of you. Read the provider agreement. Talk to all these plans, and I would say talk to all these plans, because now that there's more competition for different members' lives, they're going to be more likely to work with you if you have a relationship with the same sorts of populations that they're working with. So it's an opportunity financially, it's an opportunity for patients, it's a coordination opportunity in terms of data, in terms of case management, to get some really innovative, wonderful things done. So I would pay strong attention to this. I would take meetings with managed care, ask them what they're doing about partnership, and talk to them about collaborating around interesting projects. And in the end of the day, you may get paid for it. Next slide, please. Okay. So I talked a lot. I'm very well caffeinated. So I'm happy to answer whatever questions that you may have. But you can find a lot of research on these topics and other things with Medicaid, TANF, and SNAP at our website at communitysolutions.com. You can always reach me at this email. You can also call my cell. But I will take a breath and pause there. And I will hand it over to Kevin Jones from Impact Community Action Agency. Thank you.
Thanks, Lauren. I appreciate it. You made a really great point when you were talking about redlining and, redistricting. As folks know, we have new maps here in Ohio. And when we talk about poverty, we have to take account, policy, and we have to take account, accessibility. And so I appreciate the opportunity to be here, invited by ours, to talk about the digital divide that happens when we talk about socioeconomic households. But I like to also incorporate generational digital divide as well, because a lot of people are in poverty who are older as well compared to those younger, because of simple things like this digital divide amongst the different generations. So I first want to talk about what Impact Community Action is. So Impact Community Action is a community action agency here in Franklin County, Columbus, Ohio, with the mission to fight poverty by providing hope, inspiring help, and real opportunities for self-sufficiency. And we go by the quote and the guideline of Senator Kennedy that each time a man stands up for an ideal or acts to improve the lives of others, or strikes out against injustice, he sends forth a tiny ripple of hope, and crossing each other from a million different centers of energy and daring. Those ripples build a current which can sweep down the mightiest walls of oppression and resistance. And so we believe in creating ripples of hope here at Impact Community Action. And we recognize that we can't change our mission from reducing poverty to fighting poverty if we're not doing it through policy. And so we've taken a keen interest in this recent year to really address the policies that exist that's causing poverty to continue across Central Ohio, but all over the country and all over the state of Ohio. We have a lot of different services. We provide wraparound services here in Franklin County, so that we're doing crisis support and comprehensive case management, but then ultimately pushing folks from where they are to where they want to be. And so I'm glad to talk about, the different wins that we had, especially when we're talking about, the digital divide. I don't have any slides, so I apologize in advance. I like to just, get out there and continue talking. But some of the most interesting pieces, as you all may know, House Bill 2 that passed in May allowed opportunity for us to expand broadband. And as we were working through, well, not we, but the legislature was working through, the budget, they put in provision in there to allow $250 million for broadband expansion beyond House Bill 2. Unfortunately, once it got to the Senate, those funds were cut. And in fact, an amendment implemented limiting the accessibility and opportunity for public agencies to offer broadband at much cheaper rates. And so the digital divide is where there's inaccessibility or limited accessibility for those to receive internet access and access to technology so that they can further their education, further their business, and ultimately also to assist them addressing the health opportunities that might be possible if they had access. And so in Ohio, we have 1 million folks who are not able to receive internet access. Internet access is limited to the ability to pay, unfortunately, for such a thing. It unfortunately is limited to where you stay as well. And so in Ohio, 1 million folks, even today, are without internet access or have limited access. We look at, communities where there are 80,000 rural and urban residents who have no access, and then only 84,000 of those other residents have access based off of their phones specifically. Now, I don't know how many of you can access internet on your phones and live off of, soon to be completely hybrid and digital type of society based off of your phones, but I know that I cannot. I know that certain opportunities and abilities to reach these different opportunities in the community have to be accessible beyond just the phone. For example, most folks are not able to apply even for our application for rental assistance by accessing phones, just internet access just through your phones. So when we think about accessibility and we think about providing real opportunities to gain self-sufficiency, we have to understand that it's a wraparound ideology. We have to incorporate the understanding that internet access is a substantial part on why people are in poverty. And so the Senate President, Mr. Huffman, he believed that, the ability to cut internet access or broadband funding, I should say, in the most recent budget is an opportunity to divert the initial understanding that it supports educational, business, and health opportunities. And then some agencies and community partners like ARP says that it offers them an opportunity to provide telehealth services, especially in the time that we are in now. We think about COVID-19 and how it instantly changed policy, it instantly changed practices that, we lived by for centuries. And telehealth is one of those most important aspects. And it's one of those most important aspects, opportunity for us to be able to fight poverty, especially when we're talking about social determinants of health. And so the understanding that underrepresented minorities will remain the main target and the main people failing from the expansion, that's why we're here. We're here to be able to tackle those different understandings, because those who are underrepresented and those who don't have the accessibility to broadband service are the ones that are missing out on the opportunities that we're putting forth as agencies. And so we're here at Impact working to fight that and want to implore people to be civically engaged and advocates in their own community. And so we're glad to be a part of the process and fighting poverty and continuing to address broadband expansion here in Ohio and Central Ohio. And I'm glad to be here and be a part of the journey. I want to pass it over to Ms. Yvonne, Executive Director of ours, for a Q&A session.
Thank you, Kevin. And let me just say, I know that you guys are on mute, but if you can just give a big old hand clap to all of our presenters. You know, as I expected, learned a lot. Lauren never ceased to amaze me. Carly was just absolutely phenomenal. I love the way Dr. Davis was able to weave in all of the things that we understand from a frontline perspective. I've been knowing Will Petrick for quite some years, and he is always just as thorough and passionate about how childcare is essential to the workforce. And then to have, you know, Kevin and Nate. Nate always speaks from, you know, he is Ohio grit. He understands it, he gets it, and you can hear the passion comes through. And Brother Kevin just joined us recently at Impact Community Action Agency, and he's been a rock star there. So I knew we had the right kind of lineup, but this absolutely exceeded my expectations. And I always learn something new about what's going on with our state budget policy practices. So at this time, let's go into the questions. I want to bring up Sharon Bingo. Sharon is our content manager, so she makes sure that all of our communications and our messaging is aligned with our mission so that we can engage our community partners like we did today. So Sharon, if you can unmute, I think we have a couple of questions, so we'll take maybe 2 or 3. And then we're going to bid you all a farewell for the weekend. So Sharon, if you can come up and present the questions.
Sure. First question is really for Carly. How do we manage housing inequity? Is low income government sponsored housing the answer? If so, how does that increase Black and brown wealth when they are perpetual renters? What are we doing as a community to help create equity in spaces that have victims of racial oppressive policies which help create these inequities?
So there's a lot to unpack there. And I think that many of us, I think everyone in our membership and everybody at Impact and in Franklin County wants to address it, but we're still really scratching the surface on what needs to happen to really achieve racial justice. I completely agree that home ownership, I look through wealth building at the lens of housing. So I look at home ownership as kind of the traditional route to wealth building, and it's something that we want to promote and encourage and expand. The first step to doing that is actually through rental, because if people are spending 50% of their income renting, they are not saving for a down payment. They're not saving for that eventuality. So affordable rental housing is like step A1 of that process. But while we are doing that, we also need to be going down the track of saying, well, how are we increasing access to lending products and making sure that we are reviewing eligibility on an equitable basis and not relying on things like credit scores that, you know, are notoriously not reliable for households that are kind of outside traditional credit loops. We also need to look at different ways of building. Sorry, I've got a sick kid. This is not typical. We also need to look at land trust models and different shared equity models, and how can we envision homeownership in a different way that expands access, but quickly, without having to wait for whole systems to shift giant ships. And this may be more of a Franklin County specific answer. One of our biggest barriers right now, arguably our biggest barrier to homeownership for low and moderate income households, is we don't have the housing stock. Our average home sale price right now is $313,000, and you would need to work 5 minimum wage jobs just to be able to afford that. The inventory that we have available under 200,000 is almost non-existent, and it goes as soon as it comes. And you know those sellers don't like using FHA mortgage products that have the more favorable interest rates and lending criteria. So unless we do something about how we are building housing and putting that out into the world, primarily through zoning and bureaucracy reform, we're just going to kind of continue to perpetuate that. And those are like 6 ideas that should be supplemented by 600 more. And we need to keep talking.
All right, thank you very much, Carly. Zaria, since you ran out of time, we want to give you a chance to talk a little bit about the solutions. You shared a lot of stats and they were very troubling. And you posted a couple of bills in the chat, and I just wanted to give you a second to talk about those.
Sure. So one of just some of the bullets, I guess, as it relates to the House and Senate bill is that they are really going to be, a big piece of it is looking at people's ability to pay, right? So we talk about oftentimes the judges will set these really high bond amounts and the families can't afford to pay them. And so people are sitting in there and they're not able to fight their cases. They're losing their jobs, their housing, all the things that everybody else is talking about is oftentimes impacted. So with this, a big thing is they're going to be looking at 25% of that person's monthly income when they're taking that into consideration. Also, a few years ago, our Supreme Court justice had a task force and, they made some recommendations, some small changes across the board, but they really addressed the fact that they needed to look at people's ability to pay. And a big piece of this system is about who is detainable and who isn't, and not necessarily who can afford to get out and who can't, right? And so those are some of the things that we are now having conversations about throughout the state. And this is just throughout the state, right? Like, so in some of our rural areas, I think that this is a challenge because you have people who are struggling financially. So it becomes a situation around not just the racial disparities, but also the socioeconomic disparities for the residents within our state. And so this actually was a bipartisan bill. It was co-sponsored, and which is, can be very rare, in our state to see all sides kind of coming together, but they realized that there was a huge fiscal impact, not just on a state level, right? So the ACLU actually did a study, and I'll try to find that. And I'm a big resource person, so you can like pull information because it's just never enough to really share. But they did a fiscal analysis throughout the state and just showed like how much the state would actually save, jurisdictions would save if they actually did some type of reform. So I'm looking at it from that perspective, but then also looking at the direct cost to the families and the communities, right, that are supporting people who are in this system. And then what we also realize is we have people who are sharing their stories. We have people who literally had charges dropped after they were able to get out and show proof of, again, because we talked about that presumption of guilt instead of innocence. And so that factors in where people have to then try to get out and show like, oh, I was at work at that time. There's a camera, but no one actually goes to pull the footage from the camera, so the person's sitting in jail until they can get out. So a lot of these things, these bills are going to really open doors for people that we're serving to have an opportunity to fight their cases, to maintain their households. Their children, may not be as impacted by this because we have a lot of kids that go into the social service system because their parents are in jail and there's no one that's stepping up to take care of them. So this intersects with so many various systems that everyone has been talking about in today's session. And I just think it's important for people to take the time to read the bill. I did drop links to both in here, but then also the ACLU has been doing some different meetings where you can kind of learn more about the bill, get updates. And so I did drop that in. The next one is going to be on Monday. And also finding out how you can be engaged within your community in this conversation. There is definitely some opposition, people who obviously profit financially from this. And, there are also people who advocate, there are also people who feel like the advocates are, not sharing everything. But the reality is this is going to impact people in a very positive way. I do some work in other states just because of the work that I've been doing with PJI. And, I think this is a huge step for Ohio. In Illinois, they actually eliminated the use of cash. So in 2023, that won't even be a factor at all. We aren't at that point yet, but I think that being able to look at someone's ability to pay and what bills they have and, childcare and things like that is going to make a huge difference and how these cases are impacted. I will also say, you know, a lot of times people ask questions around like violent crimes and things like that. And in this, there is set up for people to actually have detention hearings. So they'll decide, a judge will have the ability to decide whether or not a person can be detained, right? Like if they feel like that person is a risk to someone else, right? A lot of times they'll say, oh, they're a risk to the community, right? What does that mean? Like, you know, I always debate the whole conversation around public safety, because I tell people, like, the police come after things have happened. They're not proactive. They're not preventing anything from happening, right? Like the work we all are doing are the preventative types of things, right? So, so when we talk about public safety, like, what does that really mean in this capacity, you know? So yeah, so I just want to lift that up and just encourage people, if you do have like specific like questions or want to know more ways to get involved outside of what I put in the chat, you can definitely reach out to me directly, and I'll be happy to plug you in however I can.
Okay, thank you very much, Zaria. And rest assured, we have captured all of the links Zaria posted, and they will be shared along with the slides and the recording on our website. Probably not till Monday, but we'll get it out there. Yvonne, do you want me to do one more, or shall we wrap up? One more? Okay. Will, a lot of our participants, our community action agencies, and a lot of community action agencies are Head Start providers. So Step Up to Quality is near and dear to their hearts. What are you hearing from providers about the changes to the Step Up to Quality program? Do they find it burdensome, or and how do we balance the need to not make it burdensome with the need to provide quality care?
So from broadly, most of what I'm hearing from providers is quality is critical, right? They understand that high quality early childhood education, if we want those outcomes for kids and families, quality really matters. So ultimately, you know, I think broadly from most providers, there's support for high quality early education, and support for the direction of Step Up to Quality and the kind of intent and goals of Step Up to Quality. You know, we heard in the budget process, particularly from the Senate president and from some childcare providers in his district, about concerns about Step Up to Quality and how that's impacting their businesses. And, you know, generally from most of the state associations, from Groundwork Ohio, you know, really people that I'm hearing from want to preserve Step Up to Quality. And I think it's going to be really important for your network as this study committee gets underway, that lawmakers know that we're watching, and that we do recognize that, you know, if we want a good future for kids and families, that it's critical to you know, maintain the Step Up to Quality system and to continue to improve quality in terms of our childcare system in Ohio. I also wanted to respond to that question of equity. It's a huge question. It's a really, really big question. And you know, part of what I think is important to recognize is that, you know, it's decades and centuries of people making choices, right? Lawmakers, people making choices that have rigged the rules, and shifted resources away from Black and brown communities, away from poor and working class people, and toward the wealthy and well-connected. This is one thing actually that happened in this most recent budget. So there were income tax cuts that were approved by the General Assembly. And, you know, ultimately it's going to benefit the wealthiest 1%. They're going to see an average of $5,400 each year. So over $5,000 in tax cuts. Folks making $20,000 or less aren't going to see any money back in their pockets. So, you know, I think if we really want to drill into the equity question, you know, again, that's a choice that we're making. And that also means that that revenue that they're not paying in to support is not going to high quality childcare, is not going to affordable housing, is not going to all these critical services that provide stability and security. So I think the other thing that's really important is, even with this new child tax credit, what we're seeing is, this is something that's expanding opportunity for Black and Brown families. And, research shows that if you're a kid who's living in deep poverty, and you go to school, you're either struggling with, I'm hungry, so that's going to impact your ability to learn and grow, or you might move every 6 months and have to have a new class and a new teacher. And again, that impacts your ability to learn and grow. So deep poverty really impacts kids and families. And when people have more cash in their pockets, they're able to do more. So I do think that, again, the wealthiest 1% don't need $5,000 more in their pockets. We need to direct those resources to kids and families who really need it. And that could make a difference in terms of, supporting folks who, again, have historically been excluded and left out of opportunities.
I will jump onto the tail end of that to say, that exact same analysis applies very much in the housing world. Had made choices, and we continue to make choices that are influencing what that landscape is. And I know that I'm preaching to the choir here, but I say this in other audiences where people aren't familiar with it. Do you know what the #1 housing subsidy we have in this program or in this country is? What the #1 subsidy is that's bigger than the entire HUD budget and USDA budget and Veterans Administration budget put together is? It's the single family mortgage interest deduction, which largely goes to households earning 6-figure incomes. So we are heavily subsidizing housing. We are heavily subsidizing housing in this country. We are just doing it for people who relatively need it less. And that's not a comment. I'm not calling out the single family deduction. It's an important wealth building tool, but it's part of the value system that I think we need to re-examine when it comes to housing supports and, to Will's point, everything else as well.
And thank you again to our panelists. I hope what landed well was precisely the points that Carly and Will made in terms of how this intersects everything that we're doing. So when we're talking about healthcare and Medicaid, when we're talking about the childcare and housing, it's all cyclical. And in order for us to be able to help our families who are suffering, who are in deep poverty, we need to understand how this impacts. When I cringe when I think about the statistics Kevin shared with us, 1 million Ohioans without access to internet services. And as we continue to move in this hybrid environment, more virtual than actually in person, it's going to be critical for people to be able to access their medical records, access that kind of professional care from their healthcare professionals. So I want to say again, this was an awesome way to start the weekend. We have a lot of work to do, advocates. We have a lot of work to do, ours and all of our partners here. I hope that you will continue to join us next week when we'll invite back G2G for advocacy for impact. So we're going to take all of the information we learned here from the budget bill, all of the childcare, the pretrial bill, all of the information that we've learned here and apply it to the teachings for next week. So now we can move into action. So thank you again, Kevin, Dr. Davis, Carly, Will, Lauren, and Nate. I appreciate you from the bottom of my heart for being here with us this morning. And thank you to the entire OWLS Network and our community partners for staying with us for today's Anti-Poverty Summit. Thank you and have a wonderful rest of your weekend. Thank you.